Good morning, everyone. Today, our group is discussing the state of food security in Vietnam. Vietnam has been in a very fast-paced and strong economic growth in the past 2 decades. However, to pursue that goal, we put aside many things that are now a concern, such as food security. This is a problem not just in large cities, but especially in rural areas. Here is a snapshot of how Vietnam is doing on FAO food security related indicators. To give you context, Vietnam currently has a population of 97 million people. There has been a steady decline in both number of undernourished and prevalence of undernourishment since 2006. Since 2016, however, both the number of moderately and severely food insecure people has increased from 5.9 to 6.2 million in 2020, and the prevalence percentage also increased from 6.2 to 6.5 in the same amount of time. This also reflects the trend that we observe in the state of food security and nutrition in 2020 that we discussed in class. Since it is such a complex matter, our group decided to focus on four pillars: agricultural sustainability, climate change, minority groups living in rural areas, and the impact of the pandemic on food security. There could be so many reasons why Vietnam is having these issues despite the rapid growth, but I am confident to say that it is because of the rapid growth in such a short time that we have these issues. Let me tell you why. It started during the Vietnam War. The country's landscape was completely devastated. You see right here, like massive force destruction by the US Army to counter the guerrilla warfare tactics. They use fire and chemical sprays like Agent Orange, like it's a massive plant killers, to destroy not only forest but also the farmers' land. So everything is completely burned out during that time. After the war ended in 1975, hunger and poverty was everywhere. So to recover from this loss, the government encouraged intensive monoculture of rice, black pepper, and coffee. Now, in order to maximize the result right away, we use inorganic fertilizer and pesticides to get higher crop yield. And it was a huge success for the purpose of it. Hunger was addressed with good rice supply, black pepper and coffee were traded at a premium price, and so we get a good financial assistance going. But at what cost? You see, when you only grow one specific crop in the same land year after year, nutrients are depleted and pests become more invasive. Then you have to use more fertilizers and use more pesticides, which, by the way, has to be cheap and therefore has to be synthetic. Otherwise, you cannot make money. So you repeat the cycle next year and the next year, and so it's a vicious cycle that cannot end. This leads to soil erosions, then to deforestation because you cannot use that piece of land anymore, so you have to cut down more trees to make more farmland. And this leads to natural disasters, flooding, drought, you see right here, farmers, loss of welfare, people are suffering. And so, fortunately, the government is aware of these unsustainable practices that has been going on for the last few decades, and they're taking steps to work on the Social Development Goals number 12, responsible consumption and production. So let's hear what Shravani is going to propose to help Vietnam achieve this goal.
Various solutions can be implemented to promote sustainable consumption and production patterns. Implementing on-farm technical packages similar to 1 must and 5 reductions should be made available for farmers to adopt. The focus of 1M5R is to use good quality seeds while reducing seed rates, pesticide use, fertilizer inputs, water use, and post-harvest losses, hence the 5 reductions. This type of package can be used for rice farming to help obtain higher yields and better quality rice while reducing input costs and greenhouse gas emissions. Crop rotation and agroforestry systems implemented in uplands and rice fish farming systems in lowland areas can mitigate the adverse effects of monoculture farming. In addition, this can help diversify income sources and reduce pesticide needs. In terms of the national level, the government can promote public-private partnerships. For example, the government can provide public goods to leverage private sector investments to improve commodity value chains. They can finance public infrastructure to improve production efficiency and market access for farm organizations and agribusinesses to support these partnerships. As a result, it can lead to higher quality products and lower transaction costs. Other solutions to promote better agriculture practices include using sustainable inputs such as eco-friendly fertilizers and pesticides. However, it is important to note that to have a successful implementation of these new practices and technologies requires the government's attention to enhancing farmers' awareness and facilitating farmer organization establishment and sufficient needs. Furthermore, coordinated planning, improved public services, and market development to support efficient diversification are needed to promote long-term sustainability.
Global climate change and disasters such as earthquakes, cyclones, floods, and others can cause economic losses of 250 to 350 billion US dollars each year worldwide. Vietnam is considered to be one of the most vulnerable countries impacted by climate change because agriculture, aquaculture, and fishery can be directly affected. The rise of sea level in Vietnam can cause salinization, especially in coastal Mekong Delta provinces. Combined with the effect of drought, a large proportion of rice production was affected in this region and will cost about 1.5 billion US dollars to solve it. Due to heavy rainfall, floods also happen sometimes and it causes many deaths and injuries. It also can result in large-scale damage to agriculture, aquaculture, and livestock. In the past few years, drought is most frequently reported, but it doesn't lead to serious consequences normally. Although floods happen less frequent, it is much more destructive. Climate change can also be a factor to cause the spread of pests and diseases. Pest outbreak is one of the reasons to cause severe damage. It happens in Vietnam at least once a year and can affect large areas of crops. Also, studies have shown that Vietnam is having risks of climate-sensitive health, and the level of sensitivity is high, while the adaptive capacity is very low. Some climate-sensitive diseases such as fever, diarrhea, and influenza have high possibility to cause serious problems. People in Vietnam are incapable of anticipating and adapting to disasters. It is also hard to recover from the damage and crisis. The development made by the country that has taken years to accomplish can be shattered or destroyed in a short time. When facing disasters, many families with low economic capacity tend to sell assets such as land, jewelry, agricultural tools, and food stock in exchange for money. These unpredictable changes influence daily food access and consumption of people, especially the poor. As the emission from agriculture is large, emission reduction is very important. The Vietnamese government has committed a reduction of 20% of greenhouse gas up to 2020 from different sources, including crops and livestock. The system of rice intensification, which is SRI, is a way to reduce the greenhouse gas of rice farming. For SRI, steps such as intermittent irrigation and drainage are used, and the production efficiency increases about 20%. Also, it led to a reduction of 30% for greenhouse gases. Therefore, this method can be a way to reduce the emission, and it can contribute to mitigating climate change from a long-term perspective. However, to deal with the unpredictable change of climate, crops that can adapt to different conditions such as dry environment or salinized environment can be very helpful. Also, if the type of rice can be more diverse, it can help to increase the incomes of farmers and decrease food loss. Due to the situation in Mekong Delta region, some parts are suggested to be shifted to aquaculture or other crops. While it is hard for many farmers to shift to other crops, therefore, salinity-tolerant rice varieties are needed to minimize the loss. Also, as Vietnam has a high sensitivity to climate-sensitive health with low adaptive capacity, there are several suggestions for improving the health sector. The government can try to strengthen the capacity of health staff, improve the awareness and practice the capacity of the community, develop early warning system, adapt health services and improve scientific research to reduce the vulnerability of the Vietnamese health sector to climate change.
Despite only making up 14.5% of the national population, ethnic minority groups make up more than half of the food insecure population. Between 2000 and 2014, the national figures of child stunting fell from 37% to 25%. Unfortunately, these national figures mask insignificant inequalities in outcomes among ethnic majority and ethnic minority groups. The Kin, the most predominant ethnic majority group in Vietnam, are one of the primary beneficiaries of higher living standards. Meanwhile, poverty, one of the most important basic causes of undernutrition, is heavily prevalent among ethnic minorities. Unsurprisingly, ethnic minority groups have consistently worse socioeconomic situations and significantly less access to infrastructure and services, including reduced coverage of nutrition-related health services. Due to this, undernutrition is a particularly widespread issue among ethnic minority children in Vietnam, with stunting rates among the highest in the world. Based on the 2014 Multiple Indicator Cluster Survey, the rates of childhood stunting in the northern mountainous and central highlands fall at an alarmingly high rate of 30.75% and 34.9% respectively. Here are the determinants of undernutrition in ethnic minority groups. Firstly, the inadequate nutrient intake reflects the immediate determinant of undernutrition of ethnic minority populations. In 2019, the World Bank reports that only 39% of ethnic minority children ages 6 to 23 months received a nutritionally adequate diet, compared to the 69% of kin children. With lower socioeconomic means, ethnic minority households are unable to afford diverse foods to avoid micronutrient deficiencies and stunting. Moreover, the accessibility to health services is an underlying determinant to the undernutrition prevalence. In the 2014 MICS, only 32.7% of ethnic minority mothers ages 15 to 49 made prenatal health care visits where they were provided essential vitamins, minerals, and nutrition counseling, compared to the 82.1% of kin women. Interestingly, beyond accessibility, many ethnic minority women reported not seeking health care due to its poor quality. Their concept of poor quality includes the inability to treat malnutrition, lack of female healthcare providers, language barriers, and feeling inadequate due to their inability to pay for services.
Success in the last decade to reduce national rates of stunting, the disparities between ethnic majority and ethnic minority groups has increased. In kin households, stunting fell from 21 to 6%, while in ethnic minority households, decline was only from 52 to 41%. Ethnic minorities are poorer not necessarily because they are more disadvantaged in terms of household characteristics like education, attainment, or location, but more importantly because their returns on factors such as their land and education are much lower for them than for majority groups. This demonstrates that efforts to increase returns to education by improving its quality may be just as important as making sure ethnic minority members have attained education. The world's leading rice producers. Despite this, the rate of malnutrition in rice-growing areas such as the Mekong Delta is higher than that in diversified farming areas such as the Riverbed Delta. A project on food security improvement for small-scale farmers was implemented to the Quang Nam province with the goals of agricultural diversification and innovation. However, several hurdles were encountered during the initiative. Primarily, there was an access problem as these remote regions are difficult for government and private sectors to reach. Also, there is a socio-cultural barrier, as the cultures and practices of these groups are difficult for the majority to understand, involving community leaders proved to be the most efficient method for fast diffusion of agricultural innovation. Efforts have been made by the Vietnamese Ministry of Health to target ethnic minority groups through a program called 135. This policy aimed to increase the living standards in the selected communes and included free healthcare and increased nutrition access. However, this program targeted certain areas with large portions of minority groups rather than the actual minority group itself. As a result, the policy was met with a lack of awareness about the existence of such programs among the endpoint receivers. Culturally specific strategies may be more effective in alleviating food insecurity among ethnic groups. This would account for ethnic group heterogeneity and recognize the inherent horizontal inequality experienced by different minority groups.
Now I would like to talk about how COVID-19 affects food insecurity in Vietnam. This pandemic led to acute food and livelihood crisis over the world. Due to its quick spreading, many countries declared a stay-at-home or lockdown policy to control the infection number. The government of Vietnam did the same. However, even fairly short lockdown can cause severe mobility disruption and moderate food systems. Lockdown policy affect food insecurity in 4 pillars: availability, access, utilization, and stability. Here's a table from a survey conducted on the early impacts of COVID-19 lockdowns across Asia-Pacific countries. This result shows that there are 39.1% people in Vietnam don't have food stock, and only 22.9% has the food stock for a week. Vietnam has an export-based economy, but the lockdown caused a temporary border closure leading to a backlog of exports, which could disrupt the net trade of Vietnam. In order to avoid food shortage, government of Vietnam banned the export of rice to support the domestic production and supply. Lockdown in Vietnam caused restricting food supply chain and losing the work opportunities. Seasonal cash labor or domestic remittance are essential income source for poor and near-poor farmer families in Vietnam. This could normally bring additional cash to cover protein food, essential items, and pay utility bills for the family. Losing this source of money due to the lockdown affects the family's ability to purchase food. Loss of employment has more effect on urban households in Vietnam than in rural households, because urban households may depend on employment for income to purchase food, while rural households can depend more on subsistence production, which could be less affected by COVID-19. The result of this same survey also demonstrated this. The percent change of food expenditure in rural area is 2.3%, but in urban area is 31%. School closure due to lockdown policy may lead to concerns to children's health. There are many children who are left at home all day to take care of themselves. This can lead to unhealthy diet or even food safety concerns if parents are busy or paying sufficient attention to children. The UN reports shows that 17.4% of interviewed urban area participants reported their children are having fewer meals during the day. Also, due to the daily income loss, they have less ability to purchase protein food, which leading to loss of meal quality. Children from poor families are more likely to consume a non-nutritious diet. Due to their low nutrition status, they are more prone to stunting, wasting, and severe acute malnutrition during the pandemic. Unemployment caused by lockdown attributed to instability of food security in Vietnam. As mentioned before, the production and trade disruption brought by COVID-19 have an impact on the domestic prices of major goods in Vietnam. The price of meat, like poultry, increased after the lockdown, which worsened the food insecurity condition in Vietnam. Government of Vietnam responded to COVID-19 quickly. It issued the National COVID-19 Response on January 20, 2020. In this policy, Vietnam government announced $2.6 billion social protection package with cash support for those workers who have lost jobs. This policy ensured the essential health service, protect the access of basic social service, and guiding the financial stimulants. However, the social protection package may not include all the people that are vulnerable. It is important for the government to form, for example, a cash transfer program and target the families that are not eligible to government social assistance. This will help this family to reach food security in the pandemic, and it's beneficial to support the food security in Vietnam. Overall, despite the advancement Vietnam has made towards food security, there are still several factors that need attention. Implementing sustainable agriculture, reducing the disparities between ethnic majority and minority groups, and assisting families made more vulnerable by COVID-19. That's the end of our presentation. Thank you guys so much for listening.